The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Well, they did it. As far as medical science is concerned, if you are overweight, you are not just fat. You're sick with a disease. Really? Stay tuned.
I'm Dr. James Markham. Are you interested in discovering the reason why? Do you want solutions to your healthcare problem? Are you tired of taking medications? Well, you're about to be given the ultimate prescription.
Well, it was bound to happen. In this world of a pill for every ill, the American Medical Association has now dumped a vast majority of us into the disease pool. How? By identifying obesity as a disease, right up there with cancer, heart ailments, and the common cold. Now, it's perfectly okay for us to say to a coworker, you know, maybe you should go home and rest. You look fat. Dr. Markham, am I overreacting here, or is there something we need to know?
Well, you might be overreacting just a little bit, Charles. But I think it's very important. You know, what we've been doing is I look at all the different health topics that are out there in the United States. And what we do is we look at them, see what they have to say, and then we put a biblical spin to it.
Yes.
What we do a little bit different, we recognize the place for modern medicine, especially with acute care needs. There's a special nutrition, a good brain, but it's in that relationship with God that we bring things together. And unfortunately, some of these articles, I don't see that.
Yeah.
Now, in this article that you referred to, the New York Times service, they reported, the New York Times, that the American Medical Association has officially designated obesity as a disease.
Yeah.
So if that's true, lots of people now have disease. Now this move, now remember the American Medical Association did this. This move was reportedly done to encourage physicians to take a more active role with their patients who have this condition, recognizing that obesity is you know, if doctors know about it, they'll say more and they'll do more. Yeah. But you know what? It's hard to talk about this subject, Charles.
Yes.
Okay? We're going to try to talk about it today. We're going to give people, you know, it's hard to, you love them enough to tell them that they need to work on something to lose weight. But we're going to not only talk about that a little bit today, but we're going to give everyone some strategies. Yeah. 2 strategies to help not only them lose weight today, but also their friends and neighbors. Just 2 words are going to help everyone understand and do a little bit better on weight management. Because this doesn't happen in a night.
Yeah.
Okay?
Yeah.
Now, the AMA, Charles, really doesn't have any authority to do this, okay? But it did have a lot of physicians in that group, so they thought they could make this declaration. Now, it comes at an interesting time. Now, get this, Charles, that 2 new obesity drugs.
There it is. I knew that was coming.
Obesity drugs are coming out.
Yes.
One is spelled Qusmia, Quismia, and the other one's Belvic. They've now entered the market. Now, these are not the first medicines that have entered the market. Years ago, we had one called Fen-Phen that was in the market, removed from the market. We've had other ones through the years. There's lots of weight loss supplements. Lots of them had things that would speed up your metabolism in them. Yeah. So they put thyroid in them. They had low-grade amphetamines, things like that. So, but now we have these new medicines out there now entering the market, and now, guess what? We have a new disease.
That's what I thought. When I read this, when you sent this to me and I read it, I said, someone is trying to make money here. There's dollar signs rolling around in somebody's eyes someplace here.
Now, in the United States, for instance, 2 in 3 people carry extra weight, okay? So we're going to hear more and more about this disease.
A big market.
New drugs for it, supplements which speeds up metabolisms. We're going to hear more about bariatric surgery. Do you know what bariatric surgery is?
Yeah, they bypass parts of the...
They can either bypass the stomach or they can put things like little clips on your esophagus so food can't get through them. Yeah. That's going to be another thing. But the question I want to throw out for all of us today, as we talk about this and we think about really what's going on, is why is this happening? Okay? Now, I agree that this is one of the nation's largest health issues, and that's why we're talking about it. We are not going to ignore it here. Okay?
But we're not fat because we're not taking a drug.
Right.
They're trying to make the connection there, and that's what this gets me going.
You know,
they want to make that connection.
Yeah, and I would like, can you imagine if a person would get reimbursed not for giving a medication, but for sitting down someone and talking to them and understanding why do they carry extra weight? Yeah. This is a complex issue. It might have to do with genetics. It might have to be with someone's behavior, maybe because they eat because they're depressed. It might be because they just eat too much and don't exercise. It's usually a multifaceted thing. And we know that none of the pills, none of the weight loss solutions work long term. So if we think about it that way, they're sort of setting themselves up to fail. So they got a new disease, just like type 2 diabetes. They're going to be graded by some agency that says, unless you're doing this, this, and this, you're not a good doctor. Yes. And unless you're doing this, this, and this, you're not a good patient. And yet, we're not answering the reason why. This is a catastrophe. But I'm going to leave, I have 2 words that's going to help people today that might carry extra weight, that want to help their friends, that want to help their neighbors. 2 words that can serve as treatment for people. This is very exciting, Charles. Yeah. You've never heard it anywhere before. You want me to give them to you now?
I do. I can hardly wait. No, I want them now.
Okay. It's not the new drugs Quesmia and Belvic. Okay. It's not bariatric surgery. It's not a special weight loss plan, even though that could be worked in it. It's not more exercise. It's not more drinking water, even though that's helpful speeding up your metabolism. What it is this. It's loving, not judging. Those are the things that I like to explore with us today as we talk about weight management. Loving people and not judging them. We have to meet people where they are in life, understand them, love them enough to talk to them about it, have them have enough love in their life to get the power from God to change this, to make some changes. And in the process, if we judge people, guess what? It's just like a dagger in them. Yeah. If I come up and say, Charles, you're fat. Yeah. You're fat, Charles. You have a disease, Charles.
Yes.
You don't take care of yourself, Charles. Yeah. What does that?
Go see the doctor.
What does that accomplish? Charles, you're going to get diabetes and high blood pressure and sleep apnea, and you're going to wear out your joints, Charles. All these, you can have a higher risk of cancer, Charles. All this because you carry extra weight, Charles. But 6 out of 10 people have this.
And that's the judging you're talking about.
Yes. Yeah. As we do that, does that accomplish anything?
Makes people sad.
No, it does not. And yet, now doctors are having to approach patients in a short period of time. How are they going to do this? They're not. They're going to say, well, here's your options. You want a medicine? Do you want this or you want this?
Because you're sick and you have a disease.
Yes. And they're not going to get at the real reason why. Okay. And we've done this with other diseases too. Yes. We've done this with type 2 diabetes. We've done this to a large extent with blood pressure. Rather than get at the cause of why, we give them a pill. We've done this with sleeping pills and people sleeping at night. We've done this with other things. It's the easiest thing to do. Yes. But today, as we talk today to our people out there, the approach that I want people to have is love and not judge. When we start doing this thing, when we start loving each other, guess what? God has some great plans and gives us the power to do these things. Almost everyone knows the basics of speeding up the metabolism. Charles, I'm going to teach you the basics. You know the basics of speeding up your metabolism?
Share it with me.
Okay. One is you want to move. You want to move the parts. You got to exercise. You got to get those cells, that mitochondria, working and doing things. So you got to get in some type of movement program. So if I was approaching someone and I wanted to love them, I said, listen, I know you haven't done much moving in the past, but just start with 1 minute of doing this a day and build on it. And ask Lord to give you that victory that day and go to the second day. Okay? Love them into doing something and praise them. Man, you did great. You're increasing your metabolism. You want to pick another way to increase your metabolism? How about drinking water? Yeah. That will increase your metabolism. How about this? Eating fruits and vegetables, because it increases your transit time. Things move through you quick and digest better. It pulls some of these bad things out. Eat healthier foods, and it starts in a process. How about speed up your metabolism by getting enough rest? When people are tired, their metabolism changes too. They disrupt their circadian rhythms. So all of these things we can start doing, but we do it because I love you enough to teach you how to do these things, and I love you enough not to judge you. Because if you feel like you're judged, you're never going to do it for the right reasons.
And we also have to come at this as well, that the person to whom you're saying this has to love themselves.
Yes.
Because if I don't love me, I'm not going to do what's necessary to take care of me. If I don't love me, I'm not going to do the hard work necessary, the changing of the diet, the exercise. If I don't love me, I'm not going to go out of my way. So the love is not only you to me, but me to me as well in health.
Exactly, Charles. And that's why this condition is much more broad than it's being painted right now. It's a societal thing, and we look back what's happened over the years and years, and as we've got busy, we eat fast foods, we stay inside instead of outside, we have more stress, and we tend to eat more when we shouldn't, we take more in, we tend to eat convenience food and not pick stuff and raise it ourselves. All of these things have added up. So if you really think about the solution, it's getting back to the way God made us to be.
Yes.
You know, and it starts with loving each other and not judging each other. Once we get back that way, then we say, yeah, maybe I can start doing these things. Unless those components are in place, then people feel, oh man, you know, have you ever watched that? There's a TV show on called The Biggest Loser.
Oh yes, I've seen that several times.
But people get on there and, you know, and I look at all the emotions they go through, ups and downs, and I'm wondering, that couldn't be good for a person's psyche, you know. One or two are successful, but how many are not successful? And how many can do this? Do we have the answers today? No, I don't think we're going to have all the answers. This is a ongoing problem. But there's going to be one or two people out there that are really struggling to lose weight and want to. And I want to know that the key is to have more love in our lives and not judge each other. Now, where does the source of love come from? It comes from God. That relationship with God that gives you the power. Now, judging people, that's hard in our society. You know, I had someone that was refused a job one time just because they carried extra weight. It was never said, but it was true. People are stigmatized. You look at some of the fancy things on TV. You know, if you're not exactly perfect, I'm not going to put you on TV or on this or on that. But we can't have that approach anymore because that's not going to be the best way to health.
This is very important for us to know because we are all, and you have made this clear on this program several times, that we are all healers.
Yeah.
That one of our main tasks in this world is to go to our friends and neighbors, to our family members, and to ourselves and try to make us feel better, look better, live longer, live healthier than we are now. Love has to be the motivating factor behind any information that we give to people. If I go to you and say, you know, I want you to live a long time. I want you to have a strong body. I want your arteries to be clear. And I want you to exercise, and I want you to eat these foods. That's a whole lot different. Say, you know, you're overweight. You need to, look how dangerous this is. This is going to happen to you. This is going to happen to you. This is going to happen to you. Instead, say, here are the positive things.
Yeah.
That's the way God loves us. Have you noticed that?
And not be snookered by thinking, oh, here's two medicines that are going to fix all my problems. You know, that quick, it's going to be gone. American Medical Association said this is the way it is, so it's going to call it a disease, therefore we're going to fix it. And then sometimes when they call it a disease, oh, it's not anyone's fault, it's just a disease.
It's a disease. You caught it.
You have it now.
Yes. I got a big case of obesity.
And guess what? We can fix it because we understand this. You know, and that's the thing we have to be very, very careful about as we approach this new health issue.
I'm sure that listener and viewer, you have a lot of questions on this topic, and one of the things you can do is go to heartwiseministries.org and leave the questions for us, and we will address them right here on the program like we will when we return with Dr. Markham talking about the disease of obesity. So stay tuned.